Why is residual urine volume important for your bladder? Imagine trying to empty a sink full of water, and some of it just refuses to go down the drain. That's similar to what happens when your bladder doesn't fully empty during urination. Residual urine volume, also called post-void residual, is the amount of urine left in your bladder after you finish urinating. It might seem like a small detail, but it actually tells us a lot about your bladder's health and how well your urinary system is functioning. Your bladder's main job is to store urine until it's ready to be released. When you go to the bathroom, your bladder muscles contract, and your sphincter muscles relax, allowing urine to flow out. This process is controlled by nerves that coordinate the muscles and signals. If any part of this system isn't working properly, some urine may stay behind in the bladder. That's where measuring residual urine becomes important. Having some urine left in the bladder isn't always a problem. In healthy people, a small amount of residual urine, usually less than 100 milliliters, can be normal. But if the residual volume is high, it can cause issues. When urine remains in the bladder, it creates a perfect environment for bacteria to grow. Normally, urinating helps flush out bacteria, but leftover urine can lead to infections called urinary tract infections. Repeated infections can damage the bladder lining and, in severe cases, cause infections to spread to the kidneys, leading to more serious health problems. Residual urine can also contribute to the formation of bladder stones, which are hard mineral deposits that can cause pain and blockages. When the bladder is overstretched because of high residual urine, it can become less elastic over time, leading to discomfort and long-term bladder problems. In cases of severe retention, where a large amount of urine remains, the bladder can become distended and damaged, making it harder to empty completely in the future. Doctors often measure residual urine as part of diagnosing bladder problems. This is especially true if someone has symptoms like frequent urination, urgency, difficulty starting or stopping urination, or feeling like the bladder isn't fully empty. Urodynamic testing, which looks at how the bladder and urethra store and releases urine, usually includes measuring post-void residual volume. This helps doctors understand whether the bladder is emptying properly and guides treatment options. In general, a residual volume of less than 100 milliliters is considered normal for adults. If the residual is between 100 and 200 milliliters, it might be acceptable in some cases, but higher volumes over 200 milliliters usually indicate incomplete emptying. When the residual exceeds 300 milliliters, it suggests significant bladder dysfunction and may require further investigation and treatment. Several factors can increase the risk of high residual urine. Age is a common factor, especially in older adults. Conditions like neurological disorders such as multiple sclerosis, previous pelvic surgeries, or pelvic organ prolapse can interfere with normal bladder emptying. People with these risk factors should have regular assessments of their residual urine, especially if they experience symptoms like difficulty urinating or urinary retention. In the context of bladder cancer, ensuring the bladder empties properly is crucial. Residual urine can interfere with diagnostic tests, such as urine cytology or imaging, which are used to detect or monitor cancer. It can also affect the effectiveness of treatments and increase the risk of complications. For patients undergoing bladder cancer treatment, maintaining good bladder emptying can help improve outcomes and reduce the chance of infections or other issues. For individuals concerned about their bladder health, simple steps like taking enough time to fully empty the bladder during each bathroom visit can help. If you notice symptoms like a weak urine stream, feeling like you haven't completely emptied, or frequent infections, your healthcare provider may recommend measuring your post-void residual volume. This is often done with a bladder scan, a painless ultrasound device, or sometimes with a small catheter. Based on the results, your doctor can suggest appropriate treatments, which might include medications, pelvic floor exercises, or in some cases, catheterization. Remember, residual urine volume is an important indicator of how well your bladder is functioning. Elevated levels can lead to infections, stones, and long-term damage. Regular assessment and early intervention can help keep your bladder healthy. Always talk to your healthcare professional if you have concerns or symptoms related to urination. They can provide personalized advice and help you maintain good bladder health through proper diagnosis and management.